Kidney disease is rising quietly around the world. This is a calm moment to tune in because the most useful clues appear gradually and make the biggest difference when noticed early. In the next minutes you will hear signals that many people miss and simple ways to protect your health before problems become louder. Stay with these gentle details because the end brings clear actions that are easy to apply today. Early clues save lives. Your kidneys sit on each side of your lower back and work like precise filters for your entire system. They remove waste, balance minerals like sodium, calcium, and phosphorus, support blood pressure, help make red blood cells, and activate vitamin D. When they struggle, many body systems shift at once and the effects feel scattered. Vital filters, multifunction. In the beginning, kidney problems often whisper rather than shout. Most people feel fine or only slightly off. By the time the picture is obvious, a lot of damage can be done. That is why listening to subtle signals is a powerful habit. Silent onset risk. First signal to watch: changes in your urine. If urine looks cloudy, dark brown, reddish, or purple, or if foam stays on the surface like the bubbles from scrambled eggs, something may be wrong. Feeling the urge to urinate and having nothing come out, or waking up many times in the night to pee, are also clues. Abnormal urine changes. Seeing blood in urine or noticing persistent foam can point to protein leakage, a sign that the filters are letting important proteins escape. Do not ignore these visuals, even if they come and go. Visible warning in urine. Second signal: steady tiredness that does not match your activity. When waste builds up, and the hormone that drives red blood cell production drops, less oxygen reaches your tissues. Even after a full night of sleep you may feel slow, dizzy, and unfocused. Ordinary tasks like climbing stairs or walking short distances may feel heavier than usual. Persistent fatigue. Low oxygen. Third signal: swelling in the ankles, feet, hands, or face. This often shows up evenly on both sides and may look worse in the morning. If kidneys hold too much sodium and the blood protein albumin falls, fluid slips into tissues and swelling repeats day after day. Symmetrical swelling fluid. Fourth signal: breathlessness that does not match your effort. When extra fluid backs up, it can collect in the lungs and make breathing harder. Fewer red blood cells mean less oxygen is carried around the body, which can leave you breathless even at rest. If you feel chest pressure or a choking feeling when lying down, that needs quick attention. Shortness of breath urgency. Fifth signal: dry and itchy skin, sometimes with a yellow or brown tone. When minerals get out of balance and waste products rise, the skin often reacts. Dermatologists sometimes spot kidney issues first for this reason. Dry, itchy skin sign. Sixth signal: bad breath that does not go away and a metallic taste. High levels of waste in blood can alter taste, reduce appetite, and trigger nausea. If food becomes unappealing even when you are hungry, something deeper may be shifting. Metallic taste waste. Seventh signal: sleep problems. Trouble falling asleep, waking often, or feeling unrefreshed can reflect waste buildup that irritates the nervous system. Kidney dysfunction also raises the risk of sleep apnea with repeated breathing pauses at night. Disrupted sleep, apnea. Eighth signal: high blood pressure and high blood sugar. These harm tiny vessels in the kidneys and at the same time become harder to control when the kidneys weaken. This is a loop that feeds on itself, so early control is essential. Blood pressure and sugar loop. Ninth signal: sudden muscle cramps in legs, feet, or hands, often at night. When the balance of sodium, potassium, and calcium is off, nerves and muscles misfire. If you hydrate well and cramps keep returning, consider your kidney health. Painful muscle cramps, electrolytes. 10th signal: feeling cold or having unexplained chills even in warm rooms. Kidney problems can cause anemia, which lowers oxygen delivery and makes you feel cold from the inside. If others feel comfortable while you shiver, take note. Unusual chills, anemia. If one or more of these signals repeat, a simple check can help. A blood test for creatinine and an estimate of filtration, plus a urine test for protein and blood, gives a clear first picture. Basic tests, actionable. Before we go further, a small favor that keeps this health content reaching more people. Please subscribe and activate the bell. It is free and it truly gives strength to the channel so we can produce more helpful videos. Tell us in the comments where you are watching from, city and country, because it helps us tailor examples and it is always inspiring to see the community. Free subscribe and comment. Let us return to the daily choices that support your kidneys. Simple steps done often beat big steps done rarely. Hydration spread across the day helps keep flow steady and dilutes waste. Aim for comfortable regular sipping rather than forcing large volumes at once. Steady hydration habit. Avoid routine use of anti-inflammatory pain pills without medical advice. They can reduce blood flow inside the kidney and strain the filters. Choose alternatives discussed with a professional when possible. Smart medicine use. Stay active with walking, swimming, or cycling. Gentle daily movement helps blood pressure, blood sugar, and weight control. Consistency matters more than intensity. Regular moderate movement. Plan a yearly blood and urine check, especially if you are older, have high blood pressure, diabetes, a family history, or smoke. Early numbers give you time to adjust course. Annual check. Early food choices can lower strain on kidneys while nourishing your body. Blueberries bring antioxidants to calm inflammation. Red bell peppers offer vitamins while staying low in potassium. Garlic adds flavor without extra salt, and has natural anti-inflammatory properties. Cabbage gives fiber without heavy mineral load. Apples bring pectin to help regulate blood sugar and cholesterol. Cauliflower adds vitamin C and protective compounds in a versatile way. Kidney-friendly foods list. Everyone is different. If you already have kidney disease or are on dialysis, get personal guidance from your doctor or a registered dietitian before changing your diet. Personalized medical advice. Build a simple daily rhythm, keep a water bottle nearby and take small sips regularly. Include 2 to 3 portions of suitable fruits and vegetables. Take a short walk in the late afternoon. These habits stack up. Practical daily routine. Use herbs, spices, lemon juice, and garlic for taste in place of extra salt. Home cooking helps you control ingredients and avoid hidden sodium. Your taste buds will relearn and enjoy natural flavors over time. Flavor without salt. Keep a small notebook or a note on your phone to track blood pressure, sleep quality, energy, urine changes, swelling, and cramps. Patterns reveal trends that help your doctor make decisions faster. Simple health tracking. For sleep, regular hours, fewer screens before bed, and a cooler room support deeper rest. Better sleep steadies blood pressure and improves recovery. Sleep hygiene support. If nighttime bathroom trips are frequent, shift the last drink earlier in the evening and mention it at your next visit if it continues. Nighttime urination tip. If you feel sudden chest pressure, severe breathlessness, or a choking sensation when lying down, seek help promptly. Do not wait to see if it passes. Immediate warning signs. Understand the loop of blood pressure, blood sugar, smoking, inactivity, and excess salt. These risks reinforce each other, so reducing several at once brings the best results. Even small reductions across the board help. Break the risk loop. When cooking and shopping, read labels. Many packaged foods hide significant sodium and phosphorus additives. Choosing simpler ingredient lists reduces strain on the kidneys. Check labels' hidden salt. Hydration is about regularity and comfort. You do not need to overdrink. Let thirst and steady habits guide you unless your care team advises otherwise. Comfortable hydration. For activity, think in short blocks. Stairs, brisk walks, and active errands add up. Moving a little more across the day can be as effective as a single long session. Movement built into day. When skin is very itchy, urine is foamy, or cramps persist, write down the day, frequency, and intensity. This turns vague symptoms into clear information. Document symptoms clearly. If you have high blood pressure or diabetes, tools like a home blood pressure cuff and a glucose meter make invisible changes visible. Discuss targets with your clinician and track progress. Home monitoring empowers. Kidneys like stability. Routines that keep blood pressure, blood sugar, and weight in a steady range protect the delicate filters. Stability protects kidneys. Stress management helps too. Simple breathing, short outdoor walks, and consistent bedtime calm the nervous system. Lower stress supports healthier blood pressure and better choices. Calm nervous system. For meals, plan a few go to plates you enjoy. For example, roasted cauliflower with herbs and lemon, cabbage slaw with apple, grilled peppers with garlic and olive oil, blueberry yogurt if appropriate for your plan. Tasty and simple beats complicated and rare. Tasty, simple meals. Remember that prevention is not perfection. Small, consistent steps change your biology more than occasional extremes. Think weeks and months rather than days. Consistency over perfection. If your doctor prescribes medicine, take it exactly as directed and report side effects. Timely adjustments keep you safe and effective. Medication. Adherence matters. Ask your clinician about vaccinations and bone health. Kidneys influence vitamin D activation and mineral balance, so a whole body view is helpful. Whole body care. For those with family history, talk to relatives about their health patterns. Shared information can guide earlier checks for everyone. Family history awareness. If you notice swelling prints on your socks, rings getting tighter, or a puffy face in the morning, take a photo as a reference. Visuals help track changes. Track swelling visually. If your breath smells different and mouth tastes metallic, keep a small log of foods and timing. Note nausea or appetite dips. This supports faster assessment. Taste and appetite log. If cramps wake you at night, gently stretch calves before bed and ensure your footwear supports your arches. Ask your clinician about checking electrolytes. Cramp relief steps. If you often feel cold when others do not, layer clothing and check iron status and blood counts with your clinician. Anemia is treatable and improves energy and warmth. Address anemia early. Make the environment kidney-friendly. Keep salt shakers off the table. Keep spices visible, pre-chop vegetables and store ready-to-eat fruit. What you see is what you choose. Set up for healthy choices. Choose beverages wisely. Water, unsweetened tea, and small amounts of coffee can fit many plans. Be careful with sugary drinks and energy beverages. Smart drink choices. If you have swelling and breathlessness together, that combination deserves prompt evaluation. Better safe than sorry. Combination warning sign. Consider periodic labs even if you feel fine. Creatinine, estimated filtration rate, and urine albumin create a baseline. Trends over time tell the real story. Know your baseline. If you manage diabetes, aim for steady blood sugar through balanced meals, movement, sleep, and prescribed medications. Swings are harder on kidneys than stable moderate numbers. Steady blood sugar goal. For blood pressure, measure at the same time each day, seated and relaxed. Keep a simple chart. Bring it to appointments. This improves decisions. Consistent BP tracking. Talk with your pharmacist about over-the-counter products. Some cold and pain medicines can tax the kidneys. Better choices exist. Check OTC safety. If your job or routine limits bathroom breaks, plan hydration around your schedule. Do not avoid drinking entirely. Small sips add up without overwhelming. Hydration around schedule. If nighttime trips are frequent, reduce salty foods at dinner and adjust fluid timing. Discuss with your clinician if it persists. Evening adjustments help use technology for reminders. Set gentle alarms for movement, hydration, and bedtime. Consistency is easier with cues. Use reminders for habits. When motivation dips, remember your kidneys never take a day off. Each small choice is a vote for their health. Small choices, big impact. If one or more signals from earlier resonate with you today, make one appointment and one habit change this week. Choose something simple you can repeat. One appointment, one habit. If you cook for family, keep flavors bold with herbs and citrus so nobody misses salt. Try oven roasting to deepen taste. Bold flavor without salt. When shopping, aim for the outer aisles where fresh foods live. Frozen plain vegetables and fruits are good options too. Smart grocery strategy. If your urine color changes, capture a photo and note hydration and foods eaten. Beets and some vitamins can alter color temporarily. Persistent changes still need checking. Note urine changes. If you notice foamy urine repeatedly, ask for a urine albumin test. Protein in urine is an early marker worth catching. Check for protein early. If sleep is broken, keep a wind-down routine. Dim lights, stretch lightly, and write a to-do list to clear your mind. Protecting sleep protects kidneys indirectly. Wind-down routine. If you smoke, each step toward quitting helps blood vessels that feed the kidneys. Seek support and consider medication or nicotine replacement. Quit smoking support. If you drink alcohol, keep it moderate. Too much raises blood pressure and strains many organs. Moderate alcohol choice. When traveling, pack a small kit with a water bottle, simple snacks like apples if appropriate, and your medications. Staying steady away from home matters. Travel-ready health kit. Celebrate small wins. A week of consistent walks, lower salt meals or improved sleep is progress your kidneys feel. Celebrate consistency. As we approach the close, remember that kidneys whisper. They communicate through urine appearance, energy level, swelling, breath, skin, taste, sleep, blood pressure, and blood sugar. Reading these signals is a daily skill. Listen to kidney whispers. Knowledge only matters if it turns into action. Choose one practical step today and do it again tomorrow. That is how slow damage is prevented. Action today matters. If this guide brought you clarity, subscribe and activate the bell. It is free and it truly boosts the channel, so these health messages reach more people. Tell us in the comments where you are watching from. We love seeing the community map grow. Subscribe free and share your kidneys. Keep your inner world stable without complaint. Help them with steady habits, regular checks, and attention to quiet symptoms. Protect the filters daily. The whispers you notice now prevent the crises you never meet later. Keep the filters clear and your life lighter. Prevention preserves health.